All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. Thank you guys very much for being on the call live. It is June 2nd, and we are here to serve those that serve others. That is you, the agent, so you can take care of your clients. So whatever we can do to make your life as easy as possible, faster, stronger, smarter is what we're all about here at HPM. And we live and die by that. So if there's anything that you guys need or think that we should improve on, feedback is critical at this time as we're rebuilding and building our company to make it as efficient as possible for you. But I will say that it's been a while between Cartagena and Memorial Day and all the other stuff. I really do appreciate everybody being on this call and sticking to it. I'm saying to all the new agents that are joining HPM, whether that's through one of our events or through one of our agency partners, that if there's really one thing that you should be doing right now in the business, if you want to stay on top of all the trends and your craft as an insurance agent, it's this call right here. So if you bump into an agent that's associated with us and they're not on the call, please let them know, hey, you need to be on that Monday call because you're really going to miss out on a lot of opportunities and some things that could really make your life a lot easier, especially with all the volatile changes that are happening here in the industry. It's really, really important that we continue to learn, which is what it's all about, right? With that said, you guys know the drill. We always have to keep one foot in the classroom and the other one in the field. So I'm going to share my screen here, and we're going to start going through the good stuff here. So before I go through the training calendar specifically, I do want to let you guys know that we are making some updates to HQ. As you know, we've hired a new VP of operations, and Mike is making some changes, some really, really good changes for us that is going to be very impactful when it comes to how HQ operates and how it's going to be working here moving into plan year 2026. And one of the things that you'll notice right away is this blinking red dot here. This is a new feature that we've been waiting to release, and this is notifications. So instead of us, HPM, sending you a multitude of emails regarding recertifications and things that we're missing and licensing that's expiring and all of those communications, we are now going to be centralizing them here in HQ. Now, this is going to be a giant work in progress. So I will tell you, this is the first iteration. Very proud of the team, the IT team who's been putting this together. But if you look over at your view notifications, and I just tested this morning, when you click it, the team will notify you of things that are on your to-do list or things that we're missing or things that you need to be aware of. So for instance, we're testing this out here. This says, please upload your AHIP, which is going to be coming this month. Believe it or not, it's June. And AHIP 2026 will be rolling out this month. I'm going to repeat that. 2026 AHIP will be rolling out this month in June. And so instead of you sending emails or us harassing you or trying to chase you down for this AHIP, all you'll have to do is come in here. We'll ping you, and you'll click upload document, and then you'll have a chance to go ahead and upload that document. Now, I've already done that. You can just click browse, or you can drag and drop it right in there, and that will save you from having to send emails back and forth and our contracting team harassing you, trying to get the information that we need so it doesn't become a thing later down the road. This will also go for carrier certifications as well, which is very, very important. We're going to centralize this between the contracting team and the IT team because in order for us to turn on the selling permissions for 2026, we must have a confirmation that you are RTS for that particular carrier. So for instance, if you went ahead and did your AHIP 2026, great, we'll see that there. And then you did your Humana 2026, you would just drop that certification right in here. It'll ask you to do so. And that way we have it on file. And in case anything happens, you don't have to email anybody. This we're going to be working on some automation. So when this stuff happens, it'll kick out a notification to the team that manages each HPM shop. And so your RTS notifications, our promise, and I'm saying this out loud, and Jonathan's on this call, our promise is any RTS requests, including the new certifications, once it's ready, will be delivered to you within 30 minutes or less. That means if you add a carrier, let's say you add Solis, they're not currently on shop, but if they were, you send a notification and within 30 minutes, we will have them on shop for you. Okay. So really important that, we're moving into this direction because we're trying to reduce the amounts of emails that you're getting and also to improve the communications to ensure that you guys are not missing something that's really, really important. Also reducing the communication channel between the contracting team and the IT team so everything is automated and it works and flows really nicely. So this is the next iteration of HQ. Just wanted to point that out. So let's jump into training. Remember, everything's down in the learning section. I'm going to go to training calendar here. And remember, this lives here, guys. So if you're ever like, hey, I need to get smarter, this is where you're going to come. You're going to go to week view. I like week view. It's just a little bit easier to see. So today we've got Aetna doing 2025 retention playbook. How are you going to retain your business for OEP and lock-in? That's at 9:30 today after this call. We've also got Aetna Academy, Medicare Advantage only. That's at 1 o'clock. Cigna's doing a training, doing business with Cigna. This is probably a good one to know about since they're, being taken over by Healthcare Services of America. I think is what they're called. It's basically the entity that owns Blue Cross Blue Shield. But there's going to be some changes there. The good news is they're keeping the Cigna brand at least for now. So tomorrow, June 3rd, you've got Cigna Flexible Choice Cancer, Heart Attack, and Stroke Plan. That is at 10 o'clock tomorrow. I've been on a tangent about you guys really learning how to do ancillary products. It's really, really important. It's low-hanging fruit in your own book of business. And we've seen agents add another 6 figures. I'm not even joking, 6 figures to their income just doing ancillary products. So even if you're able to do half of that, what's an extra $50,000 in income with your own book of business, offering products that really do make a difference in a person's life? You're doing it for your client, but also, hey, it's another way to increase your income. United Healthcare is doing a Medicare fundamentals at 1 o'clock tomorrow. And then Tom added in a link from the Humana agent strategy. This is a slideshow. You can grab that. That's saved over at 2 o'clock on Tuesday. Wednesday, June 4th, we've got Ask Al Clancy at 9:30. This is our virtual coffee and chat session. Your very own coach available to you there at 9:30. We've also got Spark. They're teaching a class on how to host an educational event. This is at noon on Wednesday. Also on Wednesday, Devoted, the importance of the primary care physician. That's a good one. Check that one out. That's at 1 o'clock. We've also got Cigna doing low-income subsidy, how you can help more customers. This is key and critical if you want to add, probably an extra 10 grand before open enrollment is concerned. If you're really looking to add more people to your book of business, knowing how to navigate low-income subsidy, helping people apply from a low-income subsidy, when they get approved, they get an automatic special election period. Now, if they currently have LIS, they cannot change between plans, but if you open it up for them, then you've got a new customer. So that's a good one for 3:30 on Wednesday. Moving over to Thursday, you've got Cigna Medicare Supplement Basics at 10 o'clock. Med subs are always important. Don't forget about that line of business. United Healthcare is teaching you how to navigate for TRICARE for Life and VA opportunities. That's at 1 o'clock on Thursday. UHC, New Agent Orientation. If you're new to the business, this is a good one. Be there, 2 o'clock Thursday. Learn to earn. That's what we say. Then we've got HQ. If you want to navigate this platform that we are showing you here, I do also want to point out that we have a demo available We're going to be redoing that demo because we've made quite a bit of updates, but if you want a quick demo, you can see that on top of the platform. If you don't have access to HQ, John, if you can pay attention to the chat, go ahead and ping the chat here. If you do not have access to HQ, this platform that we're looking at right now, we want to make sure that we get that set up for you this morning. Moving over to June 6th, Friday, we've got What About Shop? That's with Tom Ryan at 9:30. You can learn everything that you need to know on how to do enrollments in our quote and enroll tool for Medicare Advantage. By the way, we've also added Gold Enroll, United Healthcare ancillary products. So they've just started adding that in. If you're currently contracted with Gold Enroll, please check your HPM shop permissions to see if those products are there. If you're confused, not really sure what to do, just shoot an email over to support@askhpm.com and we will connect with you to ensure that we've got that linked and synced for you. We're building an experience in HPM shop where essentially when you add a Medicare Advantage plan, you can already add a hospital indemnity plan or Advantage Guard to that particular product in one fell swoop. So one application, two products, which makes it super easy for you and your clients to add those products in. And it's all in one application. So no double entry, no having to go back. It's all really seamless, okay? So check with that. That's 9:30 on Friday. Aetna's also teaching you how to do grassroots marketing, what it is and why it's important. That's at 9:30. And then we've got Cigna doing a compliance deep dive, fun, mitigating complaints. If you've ever gotten a complaint, this might be a good class for you to look at. That's at 10 o'clock on Friday. And then last but not least, we've got United Healthcare, Find and Engage Consumers. Again, this is marketing. We're going to talk a little bit about that this morning. And that's at 1 o'clock on Friday. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. Another thing I want to point out here at HQ is under learning as well. We've got HPM University. I have seen some of you enroll in the classes here. So these are self-paced linear trainings that you can jump into. If you have any feedback, if you've taken these classes, please let me know. We want to improve on this. We want to iterate on this, and we want to continue to build out HPM University so there's more and more content here, so you have it at your fingertips at all times. It's really, really good in order for us to level up, because I know many of you are very busy. You might not have time during the day, but maybe 8 o'clock on a Monday night, instead of Netflixing and chilling, you could be learning to earning, right? Which is way more attractive in my opinion. So think about that as you spend your time and your downtime. So keep that going. And I think a couple weeks ago, we were talking about, I'm going to stop sharing my screen for a second. One of the things that we were talking about back a couple weeks ago was what you should be doing right now as an agent, okay? What does that look like? You know, right now, as an agent, there's a few things that you really should be focused on. The first is, you know, this is your last chance to really recharge your batteries before things start to kind of pick up again. As I said earlier in the call, AHIP 2026 is rolling out this month in June. You will have AHIP, and then very, very shortly after, you're going to have all the Medicare recertifications come down the pipe, and you're going to get busy again. So if you're looking to recharge, if you're looking to spend time with your family, if you're looking to take a vacation, this is your last chance at romance. Okay, this is the best time of year to get those things, you know, on the books and you know, reconnect with your family as things start to pick up. Now, I'm not saying that you can't take a vacation in August. You know, of course you can, but you're going to be juggling recertifications. You're going to be juggling, you know, first looks. You're going to be juggling events. You're going to be juggling all these different things, and you may not be able to really focus on those things as well. So the other thing that you should be really focusing on until all of these certifications start rolling out is making sure that you're organizing your work life, spending the time to get organized, making sure that your CRM is up to date, making sure you've got all the contact information for your folks. You've got to continue to learn, and you got to continue to market yourself. Continue to market yourself. That is a year-round activity. Never stop marketing yourself. I will tell you that the moment you stop marketing yourself, it's like surfing. The waves stop coming in. So when the waves come in, when you start getting leads, you want to ride that wave for as long as it'll take you all the way back to shore, and then you got to paddle back out again. Okay? But paddling out is a lot of work. So if you're always paddling, if you're always marketing, if you're always putting in that energy into getting your name out there, you're going to have a lot more success. You're going to have a lot less paddling back out to catch the next wave. Okay. So with that, we do have a special guest on the line, and hopefully she is going to talk a little bit about marketing and what you can do to get your name out there. I see Angela Fernandez. I'm going to give her the mic. Angela is with Solis Health Plans, and I know that she's got good news for all of us. So Angela's joining us now. She's trying to, so we'll give her a second as she connects. Those of you that don't know Solis Health Plans, they have recently hit a milestone. I'll let her spill the beans on that. But essentially, Solis is a health plan out of South Florida for Medicare Advantage, and they are making waves around Florida. So a lot of wave references this morning. Don't know what that's about, but I will say Angela's been a great friend. I've known her for a long, long time. She's put up with me for a long, long time. And she's going to give you the scoop on Solis. So she is joining. I see you, Angela, but I don't hear you. There she is. You're breaking up a little bit.
Can you hear me? Oh, I'm sorry. Can you hear me?
Yeah, we got you now.
Okay, perfect. Sorry, I'm not used to the sophistication of Zoho we used to use. So
Yeah, you could
good
call it
morning,
sophisticated.
everyone.
I'm not really sure if it is or not, but good morning.
Good morning, Justin. Yes, as Justin had mentioned, we've known each other for a very long time. I want to say 2006. So
Holy
it's
smokes.
yes, it's been a pleasure. These last couple of years, working alongside you. So good morning, everyone. Happy Monday. Fresh start, fresh week, new month, new opportunities. So we're excited about that. As Justin had mentioned, my name is Angela Fernandez. I am the Director of Sales for Central Florida for Solis Health Plans. I currently oversee 7 counties at this time: Orlando, Polk, and the Tampa market. Super excited to be able to present some of the great benefits that we have, some of the great support that we can provide. But first, I want to start with a little backstory about Solis Health Plan. So Solis started about 7 years ago in South Florida, specifically in Miami. Our corporate office is in Miami as well. We are privately owned, right? So that does come with a lot of advantages, right? And flexibility. Our member services department, our social service department, case management, our utilization management, our CEO, all of our C-suite leadership is all out of our corporate office. So we are local, okay? The great thing about that is that our member services and social services department is not somewhere in India or Dominican Republic, which I know that tends to be a frustration for some of your clients at times. All of our member services and social services department either speak English, Spanish, or Creole. Okay. Super, excited to be able to provide that. Obviously, we know that in the Orlando market, Creole population, so we do have Creole reps to be able to assist those members. As I mentioned, the advantage of being on a smaller scale but growing steadily, we're happy to announce that we're over 13,000 members at this time, when 2 years ago we were only at 1,400. Okay. So we've had tremendous growth in short period of time, and how we've been able to manage that is not only through our benefits, but through our relationships with our providers. Our providers are extremely important to us. We understand that when we are structuring our benefits, it's not only the benefit of the member, but also to the provider. As you know, a lot of the benefits the carriers do provide come out of the provider service fund, right? So we're very cautious of that. With that being said, in the Central Florida market, we currently cover Seminole, Orange, Osceola, Polk, Hillsborough, Pasco, and Pinellas. So anywhere that you're at in Central Florida, you're going to be able to enroll for Solis. Our certification process is very easy, as Justin had mentioned. We're in June, AHIP recertifications. Stuff. I would highly encourage you to do Solis first and get it out of the way, because there is no video, no exams, no modules. You just click on the link, fill your profile information, transmit your AHIP. We'll do a brief background, and in about 3 days or less, you're going to be ready. Again, I would highly encourage you just to go ahead and get ours done first and out of the way, right? A little bit about the benefits. I know that's what's, mostly important when selling the plan. So our Orlando, our Polk, and our Tampa market all have separate benefits. However, we only have 3 plans in each market. We have our HMO plan for our Medicare only, which is our core. We have our dual, and then we also have our chronic plan. The great thing about our dual plan is that it does not matter which level of Medicaid, okay? They all fall under the same plan, and they are treated as a full dual, 0 across the board, okay? So there's no need to verify level of Medicaid. All we need to do is just verify that the Medicaid is active in order for them to enroll into the dual plan. Our chronic plan covers anyone who has diabetes, any kind of congestive heart failure, or cardiac condition, okay? Our plan does offer a flex allowance on all plans, okay? The flex allowance can run anywhere between $1,000 to $1,260, depending on county and plan. That flex allowance are going to be able to use for any out-of-pocket expenses for dental, vision, and hearing. We have unlimited transportation for all of our members on all plans. There is no distance restriction, and there is no trip limitation for any of the plans. We provide vision anywhere from $250 to $350, depending on plan and market. We also are dental. So the great thing about Solis is I obviously have done the comparison with all of the competitors in the market, and I would have to say that we are pretty much a complete plan, while other carriers are either missing implants, bridges, transportation, flex allowance, PAPA benefits. We have all of those. So in our dental, it ranges anywhere between $3,000 to $4,000, depending on plan and market. But keep in mind that they also have that additional $1,000 to $1,260 flex allowance that they can put towards dental as well. ED for your male clients, we're giving 8 pills a month. I know a lot of the other carriers are either providing 4 or 6. So we provide 8 a month. Our hospital copay is one of the lowest, 30 to 50, depending on plan and market for the first 5 days for inpatient, 75 to 100 for emergency care, depending on plan and market. Okay, if they do get admitted within 24 hours, we will waive that copay for them. Okay, we do have PAPA benefits. If you're not familiar with PAPA, it is a companionship service. They're able to use that for some light house cleaning, cooking, walking the dog, taking a selfie to help them, build their Facebook profile, or virtual visits, anything that they may need, including transportation to maybe a wellness center, to church, so on and so forth. So those hours depend. We're giving anywhere between 60 to 96 hours, depending on plan and market for those members. And all of the benefits that I'm providing, this is across the board for all members. The only thing that fluctuates is either the hours or the amount, but we're providing the same benefits to all plans. Okay. We also provide OTC for all of our members. The great thing about our OTC, the owners of it, which is called Sunscripts. It is mail order, but 60% of our products are brand name. Okay. There is no quantity restriction. And we also have home health products as well. So if your member needs a blood pressure machine, a shower chair, a reacher, a cane, you can order that through their OTC benefit. So no need to have to get an authorization or a script and have to go through DME for those products. We also have a healthy living allowance, which is also known as the famous food cart. So we do have that on all three plans. Again, the amount depends on plan and market as well. As far as providers, we have a lot of the providers that a lot of you work with out in the community. We have your IMAs, your Orlando Family Physicians, Orlando Family Medical, Palm Medical Center, CareMax, specialist as well. We have a good, robust network. Obviously, we have providers who work diligently in the field every day, looking to continue to increase our network. The great thing about our network is that we're an open panel. And what I mean by that is that if you ever come across a that is interested in a particular specialist or a PCP, all you need to do is contact me and say, hey, Angela, can you please, this prospect is looking for XYZ cardiologist. Can we get them in network? Our provider relations team will go out, approach, and negotiate in hopes that we can get that provider contracted. Okay. So we do have that. Any other plan is going to tell you, unfortunately, that prospect is going to have to choose one of the other 50 cardiologists we already have in network. That's not the case with us. We also have community opportunity for you all. We have CVS tabletops available. Any CVS that you can think of in the state of Florida within our service area, we have access to. So if you're interested in having any CVS tabletops, please feel free to reach out to me as well. We'll be more than happy to support those for you guys. Any community events that you may have and are participating in, Solis will be more than happy to also support. I do have 2 event coordinators, one for the Orlando and one for the Tampa market, that they handle to make sure that you guys have the tablecloth, the promos, the banners, everything that you need to make that event successful, and give you all the tools and resources. So if you have a birthday celebration, and you say, hey, Angela, can we have the DJ or the birthday cake? We'll be more than happy to support that for you. So I know my time is almost up. I was trying to get it as much as I can out there. So
you did amazing. We do have a question in the chat for you.
Yes.
Rebecca's asking, with the PAPA benefits, is the 60 to 96 hours a year, or is that per month?
It's a year, and then they're able to use anywhere between 4 to 8 hours maximum per month, depending on plan and market.
Okay, so up to 8 hours per month. Awesome.
Anywhere between 4 to 8 hours. So for example, the 60 hours a year, they're going to be able to use 4 maximum a month. The 72 hours a year will be 5 hours maximum per month. And then the 96 hours will be 8 hours maximum per month.
Awesome. So guys, I don't know if you caught that, but Angela's got CVS locations. You can actually sit inside a CVS store and grab the traffic there to talk to them about Solis. Okay, so obviously you must be contracted with Solis in order for this opportunity to be a thing. So your first step is, if you're not currently contracted with Solis, please email support@askhpm.com and we'll get you LinkedIn synced. Okay. Couple other questions that are popping in, Angela. How many stars do you guys currently have for 2025?
We're a 4-star.
4-star, excellent. And
Yes,
by the
sir.
way, guys, that is a when you're at 4-star, you actually start earning bonuses from CMS. So 4 stars is nothing to shake a stick at. Question, I already know the answer to this, but I'll let you answer it. Do you service the Jacksonville market?
Unfortunately, at this time, we do not. Hopefully, in the near future, we'll expand up to North Florida. But right now, we're concentrated in Central in those 7 counties I mentioned, plus South Florida, which includes Dade, Broward, and Palm Beach.
Yeah. You guys are currently not on our HPM Shop enrollment platform, and you've got 60 attendees. You'll probably have another 60 listen to this video, and they're all going to be pretty upset about that, Angela. So I'm going to let you know. I'll let you know that we need to work on that. Okay. So Jonathan's
Yes,
on this call. He's listening. Let's try to link and sync that because we want to try to get you on at least for 2026 for Connecture. That way these guys can, even if they live in Jacksonville and they get a lead in Orlando, they can write it, over the phone, which is a lot of what these guys are doing now. So
absolutely. I do
yeah,
want to
we appreciate
mention,
that.
since you did bring that up, we are currently exploring the option of Connecture. We
Awesome.
understand that it's really important for you guys. You can currently compare the plan, but you
Mhm,
cannot continue moving forward with the application process. We do have our own internal portal for electronic applications. It's really easy to navigate. I understand that we love to take the path of least resistance, right?
mhm,
But yeah, we do have our own internal portal. We'll be more than happy to give one-on-one trainings on those or group trainings. It's really easy to navigate. And then we also have the option for, the OGs that still like to do paper
mhm.
applications, right?
Ooh.
We do have that available as well. I will mention that the great thing about Solis is that we will not reject applications due to error, right? I know that normally a lot of the other carriers, or there's an error, they'll just completely reject the application. In our case, we will not. If there is, for example, a missing apartment number, our enrollment department is going to reach out to you directly and say, hey, it's missing an apartment number. What's the apartment number? We'll then add the apartment number and continue to continue to process the application. We will not reject an application due to error, and our enrollment department will reach out to you to get that error fixed.
Got it. We have questions about market expansion for Brevard County and Volusia. Can you spill the beans on any market expansion yet for 26?
I'm not aware at this time, unfortunately. We actually get our first looks not probably till August, which I know is a little late.
Mm.
So, once I get a little bit of information, some classified information, I'll be more than happy to, give you guys a little heads up. But for now, I do not have that information, unfortunately.
All good. Now, I put in the chat here, if you guys are interested, actually email contracting@askhpm.com if you want to get started with Solis, or you can go to HQ. You're going to click under contracting, you're going to click portfolio, and then you'll search for Solis there, and you can get started right inside of our portal system to get contracted to make it easy. Before I let you go, Angela,
Yes.
you and I have known each other for almost 20 years now. Can you believe that?
Yes,
Like,
I
look at all
know.
this gray hair I got going on, man. Like, this is crazy. Like, you knew me before I had all this. These are my
Yes.
clear hairs, by the way. They're clear. They're not gray. They're clear.
That's
Um,
wisdom. That's wisdom, Justin.
wisdom, yeah. My question to you is, you've been roundabout, you've been a marketing rep, you've been an agent, you're, a director now, and you got CVSs, and you see that the Solis applications are coming in hot and heavy. What can you share with these guys about the success that you're seeing with the agents that are selling Solis right now? Like, what are they doing? What's working? What should these guys be doing if they're not doing it already?
Yeah, absolutely. I mean, guys, you have to be out there. Field work is probably a good 90% of the workforce. Obviously, your retention is super important as well, and making sure that you're resolving any issues that your clients may have. And that's something that we're really good about. You can ask anybody who's currently selling for Solis at this time that we always pick up our phone calls, we answer our text messages, our emails, and we resolve any issues that you may have within 24 hours. That is something very important to us, right? To support you guys as well. But it's being out in the field, building those provider relationships, and always making sure that you're showing up for those providers, visiting them frequently. At one time, there could be a possibility where they're closing a particular panel and they're wanting to move that membership, and the person they're going to remember is the one that was always going to their office, right? Not the one who was visiting once a year. So
Mm-hmm.
provider relationships are super important. Being out in the field, being out in the CVSs, going into the senior communities, going into the supermarkets, any point of sale that you're able to do, any locations, that's where you're going to be able to collect those leads, which those leads will become will come into enrollments, and then which will ultimately become referrals as well. When a client is super satisfied with the plan that they're on, the support that they're receiving, they're resolving their problems, those referrals are going to come in. So field work is super important. Sitting behind a computer or working from home, it's the leads are not going to come to the door. You have to go out there, you have to hustle, and to have success. And that's what a lot of the agents that are the brokers that are currently selling for Solis, these are brokers that are out there every day, every day.
Awesome advice. So I'm glad that somebody else said it and not me. You guys got to get out there, and like she said, they ain't gonna walk through your living room, right? So
Yeah.
if you're really looking to expand your book of business and look for new clients, like she said, Angela knows, she's seen it, right? So you got to get out there, you got to get events going. So Lisa's there to help you. I will say this to make Angela's life a lot easier. We have Jose Aguayo on our team. Just email support if you're interested in getting an event with Solis, and Jose will take over and coordinate that with Angela and her team.
Yes.
So that way we don't have like 1,000 emails going to you. Jose is fantastic with organizing the events, and he'll make sure that he gets you in, to the CVS. But guys, don't ask for a CVS if you're not even contracted with Solis. Okay, you gotta be contracted with Solis. That's like, you got to do that. And like Angela said, it'll take you less than an hour to get contracted. Very, very easy, after the paperwork's been submitted. So one last thing here, Jonathan saying, get to know the staff at the CVS. That's important. Help them when you see an opportunity. It goes a long way. And one last tip that I'll tell you about this, because I don't want to miss this opportunity. If you guys are really looking for lead sources, pharmacies are amazing. And Solis, if they're in there, you're going to be in there as an advocate. And one thing that I used to do is I would go to the pharmacy and the pharmacist, and I'd say, hey, do you have any patients that when they come in and they see their copay and they're shocked and they walk away and they don't fill their meds? And the pharmacy's like, yeah, like half of them. And I'm like, okay, well, did you know that some of those people qualify for extra help and I could reduce their copay by 95%? No way, I didn't know that. Oh, and by the way, your attrition will go way down because I'm going to help you fill those meds. Now I'm talking to the pharmacist about his dollar amount, because guess what? That pharmacist is responsible for bringing in the revenue. And you just helped him create an extra $100, $200, $300,000 for that pharmacy because you're helping people apply for LIS and Medicaid. And then you open up an SEP for that person, you put them on, a good plan, and boom, there you go. So there we go. So I wanted to point that out. Thanks, John. I got fired up there for a second. Angela, I know you're super busy. Thank you for taking time this morning to share the good news about Solis. And if you don't mind, can you pop your info in the chat there, your phone number and email, just in case they need to get a hold of you. And And then guys, if you don't snap it up, you can always email us at support@askhpm.com and we'll connect you to anyone that's been on this call. In case you forgot to connect with Angela later down the road, we're happy to do that.
Absolutely. Thank you so much, Justin, for the opportunity. Hope to start seeing those certification requests come in. We're excited. We're happy to continue to grow our broker network and to continue to support you guys as well in anything that you need.
We appreciate you and we will see you soon. I know we will.
Yes. Thank you so much. Appreciate it.
You got it.
Have a great day, guys.
You got it. All right.
Thank you.
You got it. Everybody else, if you are still on the call, thank you. We will continue these calls on Monday. Back to normal reality. We'll keep this thing going. And looks like people really like the pharmacy thing. So next call, tune in, and I will make it a point to talk about tips on how to work with pharmacies. So we will see you next Monday, same time, same station. Until then, have a very productive, successful, and blessed week. We love you guys. Take care.